the 10 to 20-year life expectancy gap that exists east and west of I-35 has deep historical roots. It is unfortunately the case that in Travis County, the strongest determinant of your lifespan may actually be your zip code. And that's just the uncomfortable truth.
Housing is just so key and important, and the lack of it can be so perilous for our neighbors and for our patients. We know that people experiencing homelessness, chronically living out on the street, suffer a 10 times higher mortality rate than the general population, dying on average in their early 50s. So 20, 30-year reduction in lifespan. There's hardly any disease that has that profound effect.
I heard you say love, compassion, and dignity. I just want to say that again, love, compassion, and dignity. And I want to lift up a recent story from our medical respite program. Patients who describe that the sort of horizon line of their aspiration, their dream is, I just don't want to be uncomfortable anymore, right? I want these flies gone. I don't want to be hot anymore. That's about as far as you can see when that is your whole experience you're feeling. They describe a situation now where we have built this environment with love, compassion, dignity in mind, and say it feels calm. Folks are making art together, right? They are playing Connect Four together, and they are beginning to dream about the future. I think on the second day of being there, somebody got their food handling license on their own and told our team, this is the first time I've done something like this for me in my life. Right? I feel like I can see further. And housing is vital. And the way in which we are able to put an environment around the people who are in those environments that communicates love, compassion, dignity is just as vital, maybe more vital.
If we're going to believe the data around social determinants of health, that only 20% of someone's health outcomes are affected by what doctors do in clinics and hospitals, and the other 80% is the housing, the transportation, the food, all the other social determinants of health, then we can't keep implementing the same care model of in for a 15-minute visit and churning them out and telling them to eat better and exercise more. No, it is our problem because they're our problem and their health matters to us. And so we have to kind of flip the care model around to be able to respond to that.
The other way of thinking about this is, what's the cost of no care? And what happens for Dr. Mercer's patients if we don't do anything? We've already said someone's going to die early, and I would argue that matters. And we've actually measured this cost of doing nothing. What was the total cost of the medical expense, the lost economic productivity, and the lost life and the value of that life? Any guesses what that is in Travis County today? It's $1.1 billion every year. That is the cost of doing nothing, and the total cost to our community is massive. If we had to pass that bill to spend $1.1 billion to let our people die 10 to 20 years early, mostly Black and folks of color on the streets, in the jails. In Travis County, we would never pass that bill. But that is what's happening today. I'm reminded of a core lesson that I once learned from one of my mentors who said, optimism is a moral choice. It's not necessarily the choice that makes the most sense or the easiest, but it's what you do when the alternative is simply not acceptable.
Thank you. Love, compassion, dignity.
Yes, sir.